Hello everyone, myself Pavithra. I am working as a nursing tutor at E.S College of Nursing under Medical Surgical Nursing Department. Okay, now I am going to present about the peptic ulcer. What is the meaning of peptic ulcer? Peptic ulcer is a lesion in the lining of the digestive tract. The digestive tract starts from the mouth to anus. Mouth, then pharynx, esophagus, then stomach, then small intestine, large intestine, then rectum and anus. In this peptic ulcer formed in the GI tract, typically in the stomach or duodenum. It's caused by the digestive action of the pepsin and stomach acid. Mainly in this peptic ulcer caused by the HCl in the stomach acid secretion. That's an erosion formation or lesion in the lining of the GI tract. That is a peptic ulcer. Okay, definition. This peptic ulcer are open sore that develop on the inside lining of the stomach and upper portion of the small intestine. The upper portion of the small intestine, that is a duodenum, the first part of the small intestine. Maybe it's caused to the stomach, either duodenum, then esophagus. Then next one is the types of the peptic ulcer. Totally 3 types is there. First one gastric ulcer, second one esophageal ulcer, and third one duodenal ulcer. Okay, in this first one gastric ulcer, this gastric ulcer that developed the inside of the stomach. Inside of the stomach, that is a gastric ulcer. The lesion formation in the stomach is called gastric ulcer. Then esophageal ulcer that developed in the inside of the esophagus, in this part. That is a lesion developed in the esophagus, that is called esophageal ulcer. Then third one is the duodenal ulcer. In this duodenal is the first part of the small intestine that develop lesion in the upper section. That's the first part of the small intestine is called duodenal ulcer. Okay, next one is what is the causes for the peptic ulcer. First one is a Helicobacter pylori. It's a type of the bacteria that can causes the stomach infection and inflammation. First, they can develop in the infection and inflammation of the stomach. Then only slowly move to the ulcer formation. That is a lesion formation in the stomach, which caused by the Helicobacter pylori. Then frequent uses of the aspirin, that is a nonsteroidal anti-inflammatory drugs. It is the most common cause. Then smoking, then drinking too much of alcohol, then radiation therapy. Either in any cancer present in our abdominal part, that time we have to treat to the radiation therapy. Treatment to given the radiation therapy. It may one of the causes for peptic ulcer. Then stomach ulcer, stomach cancer. These are all the etiological factors for the peptic ulcer. Next one is the pathophysiology, how to develop the peptic ulcer. First one is due to etiological factors, that is the non-steroidal anti-inflammatory drugs or alcohol or coffee or tea. Then that leads to the excessive secretions of the HCl and decreased mucus secretion. With NSAIDs drugs and alcohol, coffee or tea, it's induce the HCl secretion. That's why the decreased secretion of the mucus. In this HCl secretion, its increase means that time it leads to the breakdown mucous membrane of the stomach. Then that leads to the acid enters into the gastric mucosa. Then that leads to gastric ulcer. Then due to the fasting, also one of the etiological factors. In this fasting, it stimulates the vagus nerve. That leads to increasing gastric secretion, and that leads to HCl secretion level may be the increase. That leads to the duodenal ulcer. Then what is the clinical manifestation for the peptic ulcer? The most symptoms is abdominal pain and burning in the abdomen. Then changes in the appetite and nausea and bloody or dark stool and unexplained weight loss and indigestion and vomiting, chest pain. These are all the symptoms may occur during the peptic ulcer. Then what are all the diagnostic tests? Medical history, either past or present medical history. We will collect the history collection. Then physical examination. Physical examination with the help of the palpation and auscultation. Then lab test, laboratory test. Then upper gastrointestinal endoscopy or biopsy. With the help of the scopy, we have to identify the lesion formation. Then upper GI serious test. Next, computerized tomography scan. These are all the diagnostic tests for we have to identify in the peptic ulcer. Next, what are all the complication may occur untreated peptic ulcer means first one, perforation leading to peritonitis and hemorrhage by erosion of the vessels in the base. Then penetration of the surrounding organ, example for the liver and pancreas. Then obstruction pyloric stenosis, that is the narrowing of the pyloric opening. Then cancer may develop, it's a rare only. These are all the complication may occur peptic ulcer. Then what is the medical or pharmacological management for the peptic ulcer? First one, antibiotic medication which kill the Helicobacter pylori, example for amoxicillin. Then proton pump inhibitors, example for omeprazole and lansoprazole. Then acid blockers, that is a ranitidine. These are all the medication we have to administer in the peptic ulcer patient. Antibiotic, proton pump inhibitor and acid blockers. Then what is the nursing management for the peptic ulcer patient? First one, we have to assess the patient condition. Evaluate the patient nutritional status, pain and vital signs and lab values. First, pain assessment, how it's the duration, how to pain. Then vital signs, temperature, pulse, respiration, blood pressure. These are all the things we have to monitor. Next one is the encouraging lifestyle changes. Recommend to eating the small, then the regular meals and avoiding overeating. Then reducing the stress. These are all the things we have to advise the patient to avoid the overeating. Then advising on diet to avoid the discomfort drinkings, that's such as the alcohol, coffee, then fatty foods, then chocolate, then spicy food. These are all the things may induce the HCl secretion excessive. Then promoting non-pharmacological method, then encouraging the patient to a biofeedback like the walking after meals and elevating the head of their bed. This so advise the patient to maintaining the regularly. Promoting the non-pharmacological method. The next one is the instructing on medication. Advise the patient to avoid nonsteroidal anti-inflammatory drugs. Example for the like aspirin and pyroxicam. Okay, these are all the things may avoid. These are all the NSAIDs drug avoid. Then monitoring for complication. Watch for the changes in vital signs and which could indicate any ulcer perforation or hemorrhage, and also check for blood in stool or emesis. These are all the monitoring for complication, either any changes in the vital signs or bloody stool or blood in the vomiting. These are all the things are present or not, we have to monitor. Then treating active bleeding. If the ulcer is actively bleeding or at risk of bleeding, then the patient may need an upper endoscopy to causes in the ulcer. Then apply clips or inject epinephrine or use to powder to form a barrier. These are all the nursing management we have to do. Okay, thank you.